Okay, here we go. Yeah, I'll ask you.
Sure.
Welcome back. Well, interesting guest with us today, Dr. Carl Rossi. And we're going to talk about proton therapy with the Scripps Institute. Very interesting stuff. I want to welcome you.
Well, thank you.
Here today. Great to have you here. First, people have heard of Scripps before.
Oh, yeah.
And we know them to be, at least I do, first and foremost, I think years and years ago, I knew somebody who worked for them as a very advanced research center in, I think, the medical field, maybe even beyond that. Is that correct?
Absolutely. Yeah, Scripps has a strong clinical mission, as do most major medical institutions. Mm-hmm. But wrapped into that, like you'd expect, is also a research mission. In fact, at the Scripps Proton Therapy Center, we have a direct clinical affiliation with the University of California, San Diego, mm-hmm. and with Rady Children's Hospital. So all three of us are collaborating to bring this treatment to the community, to fruition, and also to look at the better ways to improve the treatment in the future.
So overall, what is proton beam therapy, and what is it used for?
Sure. It's a type of radiation therapy. Mm-hmm. It uses subatomic particles, protons, to do radiation treatment. And the reason that those particles are used is that when most people think of X-ray therapy or radiation therapy, they're mm-hmm. thinking of X-rays. X-rays go in one end, something comes out the other end. Protons don't do that. They actually will stop within the body. So you can markedly reduce the radiation dose to healthy normal tissue, spare that tissue, reduce the incidence of side effects, while at the same time hitting whatever you want to hit, the cancer, very hard. So you can be sure you can control the disease while not potentially creating the same amount of side effects that you do with more standard X-ray therapy.
And how long has this been around? Is this something fairly new?
The original idea for this was published in a paper 70 years ago this month.
Wow.
Yeah. Well, like a lot of things in science, the idea precedes the technology by decades. It was first done on a very limited basis in the late 1950s. By the time 1990 rolled around, Loma Linda, where I used to be, mm-hmm. became the world's first medical proton treatment center, the first proton center that was built to treat patients, not as a physics lab that was adapted to treat a few mm-hmm. people now and then. And over the next 20, 30 years now, we've gone from one facility to where there are now 25 in the United States and about 60 around the world. The technology keeps getting better. You think about your cell phone 20 years ago versus now. The same with this machinery. It's gone from being a laboratory curiosity to where you can now have any of a number of commercial companies that actually manufacture the equipment.
And we're looking at some photos here of the rooms that are used. Yeah. And, if I didn't know what that was, I thought I'd be looking at the Starship Enterprise. Yeah. It kind of looks that way, or a movie set.
Absolutely.
It kind of explain, I don't know if these are two separate rooms or different angles that are shot, but explain what's going on here.
So these are two separate angles from the same room. This is one of our treatment rooms, and what you see on the left is a patient on that. It's actually a robotic table in the center. And the thing behind the individual that's hanging down from the ceiling, that's the nozzle. That's the part of the machine that actually emits a stream of protons and has a series of electromagnets in it to sweep the protons across whatever we're treating. Mm-hmm. So what you see in the picture on the right is a little bit of a different view of that same room. The nozzle can treat from any direction, so we can pick any angle that we want. There are things you see sticking out of the frame of the gantry, which are to help us position the patients. And in the center is a robotic table. That's what the patients are treated on. This is a table that can move to accuracies of less than a millimeter.
So the person would lay on that?
That's right.
Okay.
Yeah. This is when you have a precise treatment like this, and this beam actually when I say it comes to a stop, I mean it comes to a stop in a quarter inch or so past the target. You have to be very accurate where the patient is positioned. So we do a lot of work before we ever turn the machine on every day to make sure that patient is positioned correctly, including treating them on this robot, which is extremely accurate.
So who would be a good candidate for this type of treatment, and how would you determine the proton therapy versus more traditional radiation therapy?
First of all, protons are often used for many of the same things that we would treat with X-rays. We tend to use them where we want to spare a lot of normal tissue. So who do we treat? Breast cancer patients, spare the heart. Lung cancer patients, patients with tumors in the brain, prostate cancer. We have a lot of pediatric patients that we treat because we all know radiation is bad for healthy tissue in adults. You take a child, you multiply that by a factor of 10.
Right.
So we will often look at the patient and try to decide, well, is there a critical normal tissue we need to protect? If it's a breast cancer patient, is their heart in the way? We want to protect the heart. Sometimes we actually do comparative plans. We'll do a proton plan and an X-ray plan, and we'll pick the one that's better. So we try to make this as specific as possible. We know it's not. There's no universal treatment, nothing that's good for everybody.
Right.
But in many situations, we'll look and see, can we show a clinical advantage with protons because we're sparing normal tissue? Or we're able to get, because we're treating less normal tissue, we're able to get a higher dose into the cancer and therefore have a greater possibility of curing it. And we have a lot of clinical data to go on. We have, proton therapy has been used for a long time, although at a relatively limited basis. We still know what it works on, how it works, where it can be advantageous, and where really there may be no difference.
So again, for some people, it may be more beneficial to use the X-ray therapy.
Absolutely.
The traditional radiation
Absolutely.
therapy.
And part of being a clinician, part of the fun part of the job is, and the good part of the job is making those decisions, doing what's best for the patient. So at Scripps, for example, we have good high technology X-ray therapy as well. We have the whole armamentarium. And we'll often sit around in a meeting or a conference, and we do this on a weekly basis, and we'll put up a plan or present a patient, say, what do you think? Do you think this is best with protons, best with X-rays? Look, we've done some computer plans with both types of treatment, and which one do you think is better?
So what are the benefits, the biggest benefits of using protons, and what would be the difference between that and traditional radiation?
The biggest benefit is generally reducing complications.
Okay.
The simplest, most straightforward way to think of it is you cannot have a radiation-induced complication if you don't treat the tissue. So if I'm treating a breast cancer patient with protons and I'm not hitting her heart, I don't have to worry about, well, there's a possibility of me damaging your heart, which is sometimes more likely with X-ray therapy because the X-ray beam can't be stopped before it hits the heart, and sometimes you can't move the heart out of the way. So that's I think our primary benefit. For most of the patients we're treating, it's to spare normal tissue.
What about the overall effects of it compared to traditional radiation? They go in, they get their treatment. How often do they have to go in, and what type of effects?
In general, that pattern is very similar with protons that it is with X-ray therapy. So most patients are outpatient. Drive in each day, they'll get treated, they'll go home. Usually, for example, the prostate cancer patients I treat, I don't restrict their activity at all, nor do I need to. They're in the building for anywhere from a half hour to an hour each day, 5 days a week, typically for anywhere from about 2 weeks to 6 weeks.
Okay.
And most of that time they're in the building is either hurry up and wait,
right,
or in that room having their position checked. If someone's in that room for, say, 20 minutes, the treatment room for their treatment, the beam on time, the actual time that they're getting proton radiation, may be 30 seconds.
Wow.
The rest of it is making sure you're on target.
Interesting.
Yeah.
Now, as far as the radiation that the body receives and or retains, I don't know if that's the right vernacular to use, how does it compare?
From the standpoint of the cancer cell, a proton and an X-ray are identical. So it's killed the same way with either type of treatment. The difference is purely in how much radiation do you have to put into the normal, healthy tissue to get the dose you want to the target.
Okay. So that you still have to get maybe the surrounding tissue to prevent the cancer from growing. Is that correct?
That's correct.
And you have this beautiful center. We're seeing this. Where exactly is this located? Because I know Scripps has places all over down there.
The Proton Center is in Mira Mesa, so it's just north of the Marine Corps Air Station, and it's between, it's off a street called Camino Santa Fe. But it's about an 8-acre site. The building's 100,000 square feet. It's all dedicated to proton therapy. We like to tell people we have plenty of free parking, which is sometimes unique with the medical systems.
Yeah.
But we're located on a mesa top there in Mira Mesa. All the patient care aspects of the building are on the ground level.
Nice.
And we have some administrative stuff up on the second floor. Yeah, so it's a very nice open environment.
Now, when a patient, somebody who's watching here and has some form of a cancer, one of the things they're probably thinking is, okay, I see my primary and my specialist right up here. How do I get to a center like that? What is the process? What are the procedure to at least see if I'm a good candidate?
But there are a number of ways to be seen at the Proton Center. Certainly one of the ways, which is very common, is that patients self-refer, which is true throughout the medical field. You do not need to have, it certainly would help if you had a physician, perhaps, here's some records, et cetera, but patients can self-refer. They can contact one of our intake nurses who can guide them through the process. Here are the records that we need. We do this a lot with patients from around the country and beyond, in part because we'll look at the records in advance and say, either we think we can help you, or if we think that protons are not appropriate, then we'll tell you that. There's no reason to come 1,000 miles to be told you could have gotten sufficient treatment at home. So I see patients that self-refer. I see patients that are referred by their clinicians. As you can imagine, over the years, you tend to establish referral networks because you get to know other clinicians, and or they have their patients be treated by you, and they see the results and refer other individuals. But really, in this day and age, with the internet and people having access to a lot of information, which I think is great, many of them will guide their own course, and it's very straightforward ways to do that.
And that way, they would check with their insurance company or things like that.
Correct, and that's something we would help them with as well. In the proton world, like in all things in medicine, insurance has been somewhat hit and miss. For example, Medicare has covered proton therapy since February of 1991, so over 25 years ago. And that's been the policy to this day. For private insurers, some will cover it for certain diagnoses, some will cover it for others. That always changes, just like it does with what medication they cover this year versus the next. All
right, let me give your website. It's very easy, scripps.org/proton, and the number is 858-549-7400. Doctor, thank you very much. This is really fascinating. I appreciate you coming up and letting us know all about it.
My pleasure.
We'll hope to see you or perhaps one of your colleagues again, and we'll be right back. Very good.